Hello all, I'm Dr. Neema Bhat, Senior Consultant Hematologist, BMT Physician and Pediatric Oncologist. Today I would like to address 5 myths about blood cancers. So being a hematologist and hemato-oncologist, I treat a lot of patients with blood cancers, mainly leukemia, lymphoma and myeloma. Especially patients who have leukemia or lymphoma. These patients come with a lot of questions because it's a serious disease and the treatment can be very long. So what is number 1 myth? Leukemia, when we explain to the patient, can be hereditary or genetic. Patients get confused. Their first argument is, nobody in my family has any type of blood cancer or blood disorder. How can you say it is genetic? Here is where I would like to stop you. So genetic does not mean that a family member, so say your father, your brother, your sister, your grandfather, somebody should have had a blood disorder or blood cancer. Genetic just means that the genes, which are nothing but the elements that control us, when they go through certain changes, small changes, we call it mutation, that can act as a driver for blood cancers. Does not mean that any of your family member has to have it and only then you can get it. So we stress upon the word genetic and not hereditary. The automatic next question I get is, will my children have it because I have it? Does not mean that if you have blood cancer that your child should have it or your grandchild should have it. There are only certain conditions, we call it Down syndrome, Fanconi's anemia, Bloom syndrome, and there are a few other disorders or genetic disorders where it can be, passed on generation to generation, and those patients only are the ones who can be at risk for leukemia. Otherwise, leukemias and lymphomas are mostly genetic and they are not hereditary. Myth number 2. When we try to discharge patients after completion of their phases of treatment, first question we get asked is, will I be passing it on to my family members? Is this communicable? Is it infectious? No. Leukemia and lymphoma is something that originates in your body. Unlike viral infections, bacterial infections, or say diarrhea, it cannot be passed on from one person to another person. You only get leukemia if you have those particular genetic mutations that are causing you to have the leukemia, that are acting as the drivers for starting the leukemia. So there is no problem if you have a condition like leukemia. You can go home, spend time with your loved ones and have a good lifestyle without being in fear that you're going to spread the leukemia to your family members. Myth number 3. Can leukemia never be cured? Is a death sentence. That is absolutely not true. Being a hematologist who's treated so many patients with blood cancers, a lot of patients with lymphoma actually come to almost 90% cure and do extremely well. Patients with leukemia depends on what type of leukemia they have. If they have chronic leukemias, then they respond really well to treatment and can have long, healthy lives. If they have acute leukemias, they do require treatment for long periods of time. But if they respond to treatment, they can also have healthy lives for at least the next 8 to 10 years. Myth number 4. Leukemia presentation. I don't have any symptoms like vomiting blood. I'm not bleeding from my nose. I've not seen any bleeding in my motion or any other issues. How can you say that I have blood cancer? So it is important for us to keep movie life and real life separate. So in the movies, especially in Bollywood movies, what they show is a patient with blood cancer. The way they're detected or diagnosed is they cough and they vomit blood, or they have, bleeding from the nose, or they have bleeding everywhere. And that is how they're diagnosed with leukemia. However, in real life, that is not the case. Most of the presenting symptoms for leukemia are very subtle, and you need to pay attention to your body and symptoms for you to be able to help us pick it up as early as possible. What are the most common symptoms? Recurrent fevers. So there is no explanation, but you're getting fevers repeatedly. Weight loss. So you're not trying to lose weight voluntarily, but you're still ending up losing weight. Loss of appetite, just not feeling like eating. Fatigue or extreme tiredness. You don't feel like getting up and doing your regular activities. Maybe sometimes, yes, bleeding or bluish patches like bruises on your body. Mostly these are the symptoms. Sometimes bony pains, because leukemia mostly involves the bone marrow which is present at the bone. So these subtle symptoms are the ones that help us diagnose leukemia, and not overtly gruesome symptoms that you see being depicted in the movies. Lastly, myth number 5. Leukemia or blood cancers cannot happen in children. That is one of the biggest myths. Unfortunately, leukemia is one of the most common blood cancers, or most common cancers that is seen in children. So one of the most common cancers is brain tumors. The second most common cancer in children is leukemia. But fortunately, the good news is that leukemia in children is also very, very treatable. Most patients respond very well to chemotherapy, and we are able to deliver full doses of chemotherapy because their organs are fresh and they're able to tolerate it better. Because of which the high dose chemotherapy helps us bring remission or bring these patients' cancer under good control, and they tend to do life and come back as successful adults, with good jobs, can have a good education. So these these are the important take-home points. So 5 myths of leukemia is what I wanted to address to you about. If you have any further questions about leukemia, lymphoma, or myeloma, or any other blood-related conditions, kindly feel free to reach out to me. I'm Dr. Neema Bhat, Senior Consultant Hematologist, BMT Physician, and Pediatric Oncologist. Thank you.